Ever feel like your body is slowly giving up on you? Like, maybe your muscles are shrinking, or your bones are getting weaker, or your skin is just losing its luster. Well, you're not alone. Those are all signs of what's known as atrophy. And today, we're diving deep into how ancient Chinese medicine viewed these conditions.
Sounds fascinating.
Get ready to explore some fascinating insights from the Yellow Emperor's classic of internal medicine. We'll be focusing on Chapter 44 from the Basic Questions section, a conversation between the mythical Yellow Emperor and his physician, Shibo.
This text is a cornerstone of Chinese medicine. And you know what's really striking?
What's that?
Is how it connects seemingly disparate parts of the body. You see, it's not just a medical textbook. It's a philosophical exploration of the human body and its connection to the universe.
It's wild to think that they were pondering these connections thousands of years ago.
Right.
So what does this ancient text tell us about atrophy?
Well, it introduces the concept of Wei, which encompasses various atrophy disorders. And instead of just focusing on the physical symptoms, it digs into the root causes, linking these conditions to the 5 major organs: lungs, heart, liver, spleen, and kidneys. Each organ, according to this text, governs specific tissues and functions. For instance, the lungs are responsible for the skin and hair, the heart for the blood vessels, and so on.
So are they saying that if one of these organs is out of balance, the tissues it governs could literally waste away?
That's the idea. They believe that each organ's heat could disrupt this balance and lead to specific atrophy conditions.
Heat.
Now, this heat isn't necessarily what we'd think of as a fever. Think of it more like an energetic imbalance, almost like an overcharged battery that starts to malfunction.
Okay, I'm intrigued. So how does this heat idea play out with each organ?
Let's start with the lungs. Chibo explains that lung heat can dry out the skin and hair, making them weak and potentially even leading to paralysis. Imagine a plant that's been scorched by the sun. It withers and loses its vitality.
That's a vivid image. So what about the heart? How does heart heat manifest?
Heart heat affects the blood vessels, disrupting circulation and causing weakness and instability, especially in the legs. You know that feeling when your legs feel like jelly after a stressful day?
Oh, yeah.
That could be a sign of this imbalance.
I've definitely felt that. So it's not just physical exertion that can cause this. It's also linked to our emotional state.
Precisely. And this connection between emotions and physical health is a recurring theme in the text. Take the liver, for example. Liver heat, they believed, dries out the tendons and membranes, making them tense and tight. This can result in tendon atrophy and even, according to the text, lead to certain intimate challenges.
Oh, wow. So even back then, they recognized that unexpressed emotions can literally tie us up in knots. That's pretty ahead of its time.
Oh.
But wait, what about the spleen and the kidneys? How do they fit into this picture?
The spleen is all about digestion and nourishment.
Yep.
Spleen heat dries the stomach, leading to excessive thirst and ultimately muscle atrophy. It's like the body's internal irrigation system is drying up.
Interesting. And what about the kidneys? What happens when there's too much heat there?
Kidney heat weakens the bones, depletes the marrow, and makes it difficult to stand, eventually leading to bone atrophy. It's like the foundation of the body is slowly crumbling.
This whole concept of heat is fascinating, but it's also a bit abstract. Is there any way to connect it to something more concrete, something we might experience today?
Absolutely. Think about inflammation. We experience it as heat, redness, or swelling. The ancients might have observed these external signs and attributed them to an internal heat imbalance.
That makes a lot of sense. So while the language might sound different, the underlying principles might not be that far off from our modern understanding. But here's what's really intriguing to me. The text doesn't just attribute atrophy to physical causes. It also links it to things like unfulfilled desires and excessive thinking. I mean, how can just thinking too much cause actual physical atrophy?
It's a question that might challenge our modern thinking, isn't it?
Yeah.
But remember, the ancient Chinese viewed the body and mind as inseparable. They believed that our mental and emotional states could directly impact our physical well-being.
So what were they saying about excessive thinking and its effects on the body?
Well, they associated the liver with the smooth flow of qi, or vital energy and emotions. When we overthink, they believe, we create stagnation in our mental energy, which then impacts the liver's ability to do its job. This disruption can manifest as liver heat, leading to tendon problems and other issues.
So it's like our mind gets all jammed up and that blockage spills over into the liver, affecting the tendons.
Exactly. This idea that our mental and emotional states can have tangible physical consequences is something that modern science is only beginning to fully grasp. But here's the thing. This text doesn't just present a problem. It also offers solutions.
This is where it gets really interesting. So how did they go about diagnosing and treating these atrophy disorders?
Well, that's a whole other fascinating chapter in this ancient medical text, and one we'll dive into next time.
Okay, so we've learned that according to the Yellow Emperor's classic of internal medicine, atrophy disorders, or WEI, can stem from imbalances in any of the 5 major organs.
Right.
And these imbalances can be triggered not only by physical factors, but also by our emotions and even our thoughts.
Exactly.
Now, let's get into the nitty-gritty of how these ancient physicians actually diagnosed and treated these conditions.
Well, for starters, forget fancy labs and high-tech imaging. Kibo. The Yellow Emperor's physician emphasized the power of observation.
Really?
He believed a skilled practitioner could glean a wealth of information simply by looking at a patient.
Really? Just by looking? What were they looking for exactly?
They paid close attention to the complexion, noting its color, texture, and any unusual markings.
Interesting.
They also examined the skin, hair, nails, and even teeth, looking for signs of dryness, discoloration, or other abnormalities.
It's amazing to think that they could diagnose internal imbalances just by observing these external signs. But how do they connect the dots? What could these seemingly unrelated signs reveal about organ health?
Let's take the example of the lungs. Remember, they believed lung heat could dry out the skin and hair.
Right.
So a practitioner might observe a pale complexion, dry, brittle hair, or even skin rashes as potential indicators of this imbalance.
So it's like they were reading the body's language, interpreting those subtle signs to uncover what was happening beneath the surface.
Exactly. And this emphasis on observation is something we can learn from even today. Paying attention to those subtle shifts in our bodies can provide valuable clues about our overall well-being.
It's like becoming our own health detective.
Yeah.
Noticing those little whispers before they turn into shouts. But okay, let's say they've observed these signs and suspect an atrophy disorder. What's next? How do they go about treating it?
Treatment, according to Qi, wasn't a one-size-fits-all approach.
Right.
It was about tailoring the approach to the individual's specific pattern of imbalances. They had an array of tools at their disposal, including acupuncture, moxibustion, herbal medicine, dietary therapy, and even exercises like Qigong.
Wow, quite the toolkit. So let's bring that down. What exactly is moxibustion?
Moxibustion involves burning a specific herb, usually mugwort, near acupuncture points.
Okay.
They believed the heat from this burning herb could stimulate those points and encourage the flow of qi, or vital energy.
Interesting.
Think of it as adding fuel to the body's internal fire.
So it's like giving those energy points a little boost? And then you have acupuncture, which is a bit more familiar to most people these days.
Right. Acupuncture involves inserting fine needles into specific points along the body's meridians, which are essentially energy pathways. They believed this could help regulate the flow of qi and restore balance.
Okay, so those are the hands-on techniques. What about herbal medicine and dietary therapy? How did they use those to address atrophy?
Well, each herb was believed to have specific properties and energetic effects on the body. They might prescribe herbs to tonify a weakened organ, clear excess heat, or nourish depleted tissues.
So it's like creating a custom blend of herbs to target the specific imbalance.
Precisely. And dietary therapy worked in a similar way. They believed certain foods could have a warming or cooling effect on the body, so they would tailor the diet to address the individual's needs. For example, they might recommend cooling foods like cucumber or watermelon for someone with excess heat, or warming foods like ginger or cinnamon for someone with a deficiency.
It all sounds so personalized and holistic. It's not just about masking symptoms, it's about addressing the root cause and restoring balance to the whole system. But out of all these treatments, Qibo seems to emphasize the importance of the Yangming meridian. He calls it the sea of the 5 organs and 6 bowels, and says it's crucial in treating all types of atrophy. Can you tell us more about this Yangming meridian and why it's so significant?
The Yangming meridian is one of the 12 main meridians in Chinese medicine. It's a pathway of energy that flows through the body, connecting various organs and tissues. What's unique about it is its role in nourishing the tendons.
Interesting. So it's like a superhighway of energy specifically for the tendons.
You could say that.
But why are tendons so important in this context?
Well, in Chinese medicine, tendons are seen as more than just connective tissues.
Okay.
They are believed to play a vital role in our overall flexibility and movement, both physically and energetically. Qibo believed that by strengthening and nourishing the Yangming meridian, we can promote the healthy flow of qi throughout the body, which in turn can help address various atrophy disorders.
It's like giving the body's energy system a tune-up. But how do you actually strengthen this meridian? Is it through acupuncture and those other techniques we talked about?
Absolutely. Acupuncture and moxibustion can be used to stimulate specific points along the Yangming meridian, but they also emphasize lifestyle practices like Qigong, which combines gentle movements, breath work, and focused intention to cultivate and balance qi.
So it's not just needles and herbs, it's also about actively engaging with our energy through movement and intention. I'm really starting to see how this ancient approach weaves together the physical, mental, and energetic aspects of well-being. But I'm curious, did Qibo ever mention anything about prevention? Is there anything we can do to avoid these atrophy conditions in the first place?
That's a great question, and it's one that Qibo addressed directly. He emphasized the importance of living in harmony with nature, maintaining emotional balance, and avoiding excesses in any area of life. He believed these simple yet profound principles could go a long way in preventing a wide range of health issues.
So it's about finding that sweet spot of balance in all aspects of life. Not too much, not too little.
That's right, exactly. He highlighted the importance of proper sleep, regular exercise, and a balanced diet as key factors in maintaining overall health and preventing imbalances.
Okay, those are pretty doable, even for us busy modern folks. But what about the emotional balance part? Any tips for managing those pesky emotions that can create heat in the body?
Qibo recommended practices like meditation, deep breathing exercises, and cultivating positive emotions like gratitude and joy.
So it's about taking those moments to pause, breathe, and shift our perspective. But in our go-go-go world, it's easy to forget those simple yet powerful practices. But I'm curious, how does this ancient wisdom, with its talk of heat and energy meridians, compare to our modern understanding of atrophy? Does modern medicine validate any of these ideas?
That's a fascinating question, and one we'll explore in our final segment.
It's amazing how much wisdom we can glean from these ancient texts. Even thousands of years later, we've been talking about how the Yellow Emperor's classic of internal medicine views atrophy, linking it to imbalances in the 5 major organs and highlighting the importance of the Yangming meridian in treatment. But I'm curious, how does this ancient perspective, with its talk of heat and energy meridians, stack up against modern medicine's understanding of atrophy?
That's a question that often comes up when exploring traditional medical systems. Modern medicine has certainly made incredible strides in understanding the biological mechanisms behind atrophy. We've identified specific genes, proteins, and cellular pathways involved in muscle wasting, for instance. We can pinpoint things like nerve damage or hormonal changes that contribute to these conditions.
So we've gotten really good at the what, identifying the physical processes involved. But what about the why? Does modern medicine delve into those deeper questions of what causes those initial imbalances?
That's where the two perspectives diverge a bit. Modern medicine often focuses on treating the symptoms, targeting those specific pathways we've identified.
Right.
And while that's incredibly valuable, it sometimes misses the bigger picture, the interconnectedness of our physical, emotional, and mental states that traditional systems like Chinese medicine emphasize.
So while we might be able to address the physical manifestations of atrophy, we might not be addressing the root cause, which could be emotional stress, dietary habits, or even a lack of meaningful connection with nature, as Thibault suggests.
Precisely. And that's where this ancient wisdom offers a valuable complement to modern medicine. It reminds us to look beyond the isolated symptoms and consider the whole person, the intricate tapestry of their life experiences, emotions, and lifestyle choices.
It's like we've zoomed in so closely on the individual threads that we've lost sight of the overall pattern of the tapestry. But if we step back and integrate those two perspectives, we gain a much richer understanding.
Exactly. Imagine a doctor who not only prescribes medication to address muscle wasting, but also explores the patient's emotional landscape, dietary habits, and their relationship with stress. That holistic approach could potentially lead to more effective and sustainable healing.
I'm starting to see how these two systems, while seemingly different, can actually work together to create a more complete picture of health.
It's not about choosing one over the other. It's about recognizing the strengths of each and finding ways to integrate them for the benefit of the patient.
This has been such an eye-opening exploration. We've uncovered some truly fascinating insights from the Yellow Emperor's classic of internal medicine, delving into the ancient Chinese understanding of atrophy and how it connects to our organs, emotions, and even our thoughts. But as we wrap up this deep dive, what's the one key takeaway you'd like our listener to walk away with?
I'd say the most important message is that our bodies are not just machines. They're intricate ecosystems, interconnected in ways we're only beginning to fully grasp, whether we're dealing with a specific condition like atrophy or simply striving for overall well-being. It's essential to consider the whole person, acknowledging the interplay of our physical, emotional, and mental states.
So it's about honoring the wisdom of both ancient traditions and modern science,
Yeah.
recognizing that each offers valuable pieces to the puzzle of human health.
Precisely. By integrating those perspectives, we can move towards a more holistic and personalized approach to healing, empowering individuals to take an active role in their own well-being.
Well said. And on that note, we'll leave you with one final thought to ponder. Qi emphasizes the importance of nourishing the tendons as a key element in treating atrophy disorders. But what does it truly mean to nourish our tendons? Is it just about physical exercise and proper nutrition? Or could there be a deeper, more energetic dimension to this concept? Perhaps exploring practices like Qigong, cultivating mindfulness, and tending to our emotional well-being could be powerful ways to nourish those vital pathways of energy.
It's a fascinating question to explore. And as we've learned from this deep dive, there's always more to discover, always deeper layers to uncover.
So keep exploring, keep questioning, and keep listening to your body's whispers. Until next time, keep diving deep.